declining over time. Declines with regards to differences in teen pregnancy rates among adolescents, for example, between the ages of 15 to 19. We know, though, that the disparities persist. And that we do, while we think about certainly the work that is underway within our healthcare system and within public health through really transformative legislation such as the Affordable Care Act, which is providing access to millions of Americans to quality, affordable health coverage, access to care, and really working towards improving the quality of care. We also know that in order to really advance equity, that we have to think about these broader upstream factors, and so that has been a driver certainly for us as an office for the work that we're doing here in the department. And so some of our framework really in addressing health disparities has been how we can reach across sectors. You saw in the presentation earlier, and in partnership, the National Partnership for Action to End Health Disparities, also known as the NPA, which is a nationwide community-driven movement towards combating health disparities that takes on a social determinants of health approach. And it really serves as a catalyst for those who are committed to action to be able to think beyond their sectors and think about how we advance, for example, equity in all policies. And so because of this National Partnership for Action, we now have, which is coordinated by the Office of Minority Health, we now have a federal interagency health equity team that is comprised of 12 different federal agencies across the government, from housing and urban development, education, transportation, agriculture, veterans affairs, and others, many of whom are here today, working towards how we can advance equity in all policies, how we build the leadership to be able to address these often complex issues. We also have state offices of minority health who serve as partners who have aligned their state health disparities plans, strategies towards addressing health disparities and utilizing the goals of the National Partnership for Action. And there are also regional health equity councils. One that exists in each of the 10 HHS regions. It corresponds geographically to the 10 HHS regions that are non-federal entities comprised of individuals not only in public health and healthcare, but also faith-based organizations, the private sector, and others who are all looking to what are the most pressing issues within their regions to be able to address health disparities, because we know that while disparities, we see certain national trends, we also know that there are unique aspects community to community and how we can tailor our approaches.